People nowadays have more resources available to learn about their health, such as browsing on the internet or talking to healthcare providers. It's important to take care of your health, but it's even more important to learn which of the medicines you are using should be taken with or without food. So, one of the most important questions you need to ask your healthcare provider is, which foods should I avoid taking with my medications? Asking this question will help you to avoid potential problems associated with food-drug interactions. So, what is exactly a food-drug interaction? A food-drug interaction occurs when the medicine you take mixes with the food in your stomach. This mixing of medicine with food can lead to some serious side effects, and even sometimes a drug can change the way your body uses the food you eat. Although the list of these medicines that interact with food is quite small, but it's better to know which foods should be avoided with a certain medicine, as some of these medicines are commonly used in every household in Pakistan. Some antibiotics such as tetracycline and ciprofloxacin should not be taken with any dairy products, including milk, cheese, yogurt, or any food made with a dairy product. Because dairy products decreases the absorption of medicine in your body, which results in delayed response or poor efficacy of the medicine. To avoid this problem, always take your medicine 1 hour before or 2 hours after consuming a dairy product. Always ask your pharmacist to guide you about which antibiotics should be avoided with dairy products, as some antibiotics such as metronidazole needs to be taken with milk to avoid stomach problems. Foods as well as beverages are responsible for food-drug interactions. For example, if you take cholesterol-lowering medicines with grapefruit juice, what happens is that the grapefruit juice blocks the action of the enzyme that is responsible for the metabolism or breakdown of the drug in your body. So as a result, too much drug remains in your body for a longer period of time, causing side effects. For your safety, always take your medicines with a full glass of water, or you can go and ask your doctor to switch you to other cholesterol-lowering medicines. Some other medicines that needs to be avoided with grapefruit juice include the anti-allergic medicine called fexofenadine. In this case, the grapefruit juice can block the transport of medicine, resulting in decreased amount of medicine in your body, and so the medicine will not work. Some more examples include calcium channel blockers, which are the blood pressure lowering medicines. In this case, grapefruit juice actually causes the increase in the level of drug in your body, due to which your blood pressure can drop suddenly, which can be very dangerous. Also, avoid taking your medicine with tea or coffee, as coffee and tea contains chemicals called tannins, which can bind to your medicine and can prevent the absorption of medicine in your body. If you're using antidepressant medicines, including tricyclic antidepressants or phenothiazines, avoid taking these medicines with tea or coffee. Also, it's best to ask a pharmacist to guide you regarding the safe use of medicine. A number of commonly used herbal supplements, including green tea, can interact with your prescription medicines. According to a study published in the British Journal of Clinical Pharmacology, these interactions can make your medicines less effective and may even be dangerous or deadly. Patients suffering from depression, patients having an organ transplantation, cancer patients on chemotherapy, and patients taking blood-thinning medicines such as warfarin can experience some severe side effects of taking herbal supplements or herbal teas. So, such patients should avoid taking herbal supplements completely. and should consult a pharmacist for possible drug or food interaction. Some medicines like monoamine oxidase inhibitors, which is the class of antidepressant medicines, should not be taken with certain foods such as chocolate, cheese, chicken liver, avocados, sausages, and pepperoni. Because taking monoamine oxidase inhibitors with these foods can be dangerous for you, as they increase your blood pressure to a dangerously high level, causing severe headache, brain hemorrhage, and also, in some cases, it can cause death. So, avoid taking antidepressants with these foods and consult your pharmacist for advice. Diabetic patients who take diuretics including hydrothiazide and spironolactone should avoid eating licorice because it reduces the effect of medicine in your body. Patients who are using blood-thinning medicine called warfarin should avoid all foods containing vitamin K, as vitamin K diminishes the effect of their medicine. Some common foods that contain vitamin K include vegetables like spinach, broccoli, turnip, and other green vegetables. If you are taking aspirin for pain, avoid foods containing vitamin C, vitamin K, thiamine, folic acid, and amino acids, because aspirin decreases the absorption of vitamin C, vitamin K, thiamine, folic acid, and amino acids in your body. Patients who are taking anti-ulcer medicines such as omeprazole and ranitidine should avoid taking vitamin B12 containing foods such as meat, chicken, and milk, because anti-ulcer medicines decreases the absorption of vitamin B12 in your body. When a pharmacist asks you to avoid some foods with your medicine, it doesn't mean that you should not eat them at all. Of course you can eat these foods, but always make sure that if you plan to eat a food that is supposed to interact with your medicine, take your medicine at least 1 hour before eating your food or 2 hours after you have eaten your food. As a further precaution, always make a habit of reading the label or leaflet of all your prescription and non-prescription medicines, including multivitamins and herbal supplements. If you experience any unwanted side effects with your medicine or you are not getting any result from taking your medicine, get yourself assessed for food-drug interaction by your pharmacist or your doctor. Always remember, when purchasing your medicine at a pharmacy, ask the pharmacist to guide you for food-drug interactions. If you don't have this information for the medicine you are taking already, or you forgot to ask this question from your pharmacist or your doctor, remember, you can always ask our pharmacist at Mahir-e-Adviyat, who are here to guide you 24/7 regarding your medicine. Stay safe, stay healthy, and remember, it's your right to know your medicine.